Washington Hospital, this is AMR 562.
Washington 1, go ahead, please.
Washington, we're inbound with a 45-year-old male, chest pain.
Heart rate is 88, respiration 22. Advanced cardiac life support is
562, we copy. We'll see you code 3. Washington 1's clear.
A medical emergency can happen at any time. In fact, one happens every 5 minutes here in the Tri-City area. Every second counts. And that's why a well-trained, highly efficient emergency room team becomes absolutely crucial. Sometimes it's a matter of life and death. You may never have to see the inside of the Washington Hospital Emergency Department firsthand, but if you do, it's comforting to know that our facility and our staff are among the very best anywhere. The Washington Hospital Emergency Department has been in operation since 1958 and is now the second busiest in the county, treating an average of 43,000 patients every year. Dr. David Orenberg is the Medical Director of Emergency Services at Washington Hospital.
Most people we would probably advise that they should call their doctor first, unless they are experiencing symptoms that might be life-threatening. If you have any doubt whatsoever that something is wrong, you're not feeling well, I think you should come to the emergency room.
Tell me, do you give advice over the phone?
You can call, but we don't give advice by hospital policy. Really about the most we can do is maybe direct you to call 911, call your doctor, or assure you that if you want to come into the emergency department, we'll be happy to see you.
Washington Hospital's emergency department is located at 2000 Maury Avenue in Fremont. And upon arrival, the patient will experience a triage examination.
What were you doing when the pain started?
The triage nurse will take vital signs,
Exercising.
blood
What
pressure,
time was this?
temperature, and oxygen levels. The triage nurse will ask questions
part of your chest
and make an
is-
assessment of the severity of your injury or illness.
How would you describe it?
All our nurses are triage trained in identifying certain risk factors, certain signs and symptoms that place you at risk, and then they can determine what category you need to go in as far as your medical severity and how soon you need to be seen for a life or limb threatening event.
And on a scale of 0 to 10, how bad is it?
The triage nurse's job is to sort which patient has to be seen by the doctor the quickest based on the acuity of what's going on with them. If there's nobody waiting to be triaged, they'll bring them right in and start the process. Otherwise, they might be asked to wait in the waiting room till they finish triaging whoever they've got in front of them at that time.
Any problems breathing? A little. Are you nauseated?
The overriding principle is to treat the sickest first.
Under your tongue.
However, we do have a fast track program, which we can then identify patients which have minor problems and kind of put them on a parallel course. And they sometimes will be seen faster than somebody who has a more severe problem, but non-life-threatening type situation who need to go first.
What about bedside registration? How does that work?
Bedside registration is something we're looking at implementing, and essentially we'll be able to do the chart and do the demographic information at once right at the bedside so we can room patients. It'll facilitate rooming patients immediately because we can take, if we have an open room, we can take you right back to a room. You don't need to stop at any of the desks.
Have you had a chest pain before? Not like this. Not like this. Any medical problems?
Not that I know of. I have this saying in place, sort of a new philosophy for our emergency department, that there will be no bed left empty. The bedside nurse will do most of the triaging. A registration clerk will come back and register the patient, and the physician will see the patient sort of colliding upon the patient all at the same time.
How's your pain right now? Is it getting any better or getting worse? Feels the same.
If you need to come to Washington Hospital's emergency department, the staff suggests you bring a list of the medications you are currently taking and your insurance information. Also, because of space limitations, bring one family member who can be alongside you during the process. The emergency department is equipped to handle almost all emergencies, and the dedicated staff of approximately 100 nurses and 16 physicians is here to aid you in your recovery.
And ask them to pull it.
Yeah,
But we have double coverage, meaning 2 physicians working at the same time for most of the day. At other times, we have 3 physicians, and there's only limited times during that 24-hour period where we only have a single ER physician.
Anything else besides chest pain? Okay.
We've got some
Where's your
nurses that have been here 30 years, 25 years, so we have a lot of longevity, a lot of cohesiveness, and a team effort as we try to take care of patients in a stressful environment.
Okay, go ahead and lay back.
This ER is special because of how long people have worked in this department, how well trained they are, how they genuinely care about the patients and each other. On a Traveler website, I was told that the Washington ER is incredibly highly rated because of how easy the staff is to work with here. The nurses and the physicians are like family to each other because of how long we've been here.
Emergency care is necessary when a patient is suffering from a life-threatening medical condition. The emergency room department at Washington Hospital has special programs and technologies to treat and manage catastrophic illness and life-threatening injuries.
We have two really new programs that I'm very excited about. The first one is our acute MI program, in which patients that are experiencing chest pains, that have acute heart attacks, are seen immediately. Cardiologists are involved, and those patients are taken over to the cath lab, where hopefully we can get a small little balloon into the artery that is causing their heart attack. This process actually starts in the field with our paramedic EKG program, where the paramedics now have the capability of doing that EKG. That EKG is then sent to us by fax. We can read the EKGs before the patient even gets to the emergency department. And then that whole process is put into place. In my 25 or 30 years of practicing emergency medicine, I think there's no question that this is the most exciting change in the practice of medicine. The other program which is similar to that is our stroke program, which is relatively new. And patients, again, are recognized as potentially having stroke symptoms when they come to the emergency department. We have a whole stroke team in place, including a nurse, a neurologist, and of course the ED physician and our nurses. Patients are sent over for CAT scan immediately, and then we decide the appropriate treatment modalities. And that is really something new. Strokes were not handled this way in the past.
Digital radiology has really improved the turnaround time from X-ray to the time that the doctor is actually able to see the picture of the X-ray. And so now there's no downtime. As soon as they take the X-ray and load it into the system, they can see the image. It used to be, it could be anywhere from 30 minutes to an hour. And so the ultimate impact of that for patients is that we can see you, get the X-ray, get the result, and get you out of the ER that much sooner.
If you're an adult patient, we have the hospitalist program, which are doctors that are in the hospital 24 hours a day, and they take the patients who are unassigned doctors, and they will determine with the ER doctor whether you need to be admitted, and what floor you need, what services you need, and they'll be your doctor while you're in the hospital. We have a diverse staff, and so they do speak some languages within our staff, but we're required to have a 24-hour language access line, and this language access line has certified medical interpreters of about 300 languages and a bunch of dialects. So we have 24-hour access for that if a family member is unable to accompany you to help, interpretation of your care.
There is another option if your condition is not life-threatening. An urgent care center is a facility that specializes in minor emergencies. Washington Hospital operates 4 healthcare clinics in the Tri-City area, and the urgent care center across the street from the hospital at 2500 Maury is open 7 days a week from 8 a.m. to 8 p.m. Though urgent care centers offer some of the same services as the emergency room, they differ in several important ways. Take the patient to the emergency room for stroke or heart attack, severe shortness of breath, unstoppable bleeding, poisoning, major head injuries, complicated fractures, and certainly suicidal or homicidal feelings. Take the patient to the urgent care clinic for respiratory infections, colds, flu-related symptoms, fever, vomiting, minor cuts requiring stitches, less complicated broken bones, and athletic injuries.
Okay.
Dr. O, I have a chest pain in 9.
Okay. What's the story?
He was at a gym exercising about 15-20 minutes. Developed mid-sternal right-sided chest pain radiating to his right shoulder.
Okay.
Difficulty breathing,
How
Little
old?
diaphoretic, 25.
Vitals are okay?
Yes. Little tacky on the monitor.
Okay, he's a little hypertensive too. Okay, well, let's go look at it.
The emergency room at Washington Hospital, on average, treat 130 patients a day with a highly skilled staff of nurses and physicians who have specialty training in managing life-threatening injuries.
And so this was just a typical day on the treadmill, right? And then what was different? What happened?
My chest started to really hurt.
I think we have one of the most stable ER physicians groups in the Bay Area. Between the 15 physicians, our experience is well over 300 years in emergency medicine. And the original 6 ER physicians that started here in the mid-70s are still practicing. So we have an extremely capable physician staff that I'm really very proud of. And if indeed we find what I think we're going to find, then I'm going to have to put a little tube into your lungs, and I can explain everything to you at that point in time. Okay?
We here as employees recognize that we do serve the Tri-City area. As a district hospital, we feel like we need to be responsive to the needs of our local community and provide the service they need so they don't have to travel out of the area to obtain service somewhere else, which could be more stress-inducing because they're away from their family. And so we need to provide a higher level of service for people so they don't have to travel far.
I think that we provide incredibly top-notch service. We're very picky about the nurses that we bring in and train. The staff have worked here for a long time. The physician group has worked here a long time. There's a good portion of the staff, including myself, that have been here 20 years or greater. And we're pretty much a family in this department, which really enables the communication process in terms of taking care of patients.
We've provided excellent, efficient, extremely capable care over the years. And it's very important for a community to have a stable, well-functioning emergency department to take care of the needs of the community.
Washington Hospital, this is AMR 562.
Many events in our lives are unplanned and unexpected, but that doesn't mean we have to be unprepared. If you think you have to go to the emergency room, go. Go, please. Dial 911 and get yourself to the hospital. Every second counts, and that's why a well-trained, highly efficient emergency room team is there to help you. I am John Thomas Mahegan, and thanks for watching.